and we shall be back with many of your questions. You still can interact with us on our YouTube page, Facebook, and Twitter. Our handles are Doc Talk Show. See you shortly.
You are watching the Doc Talk Show.
The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Century Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go. MTN.
You are watching the Doc Talk Show.
Welcome back. It is a Doc Talk Show, and I'm your host, Dr. Gyaganda Joseph Ogavu, and we have dedicated this show to answering your hot questions about COVID. So Miriam here is asking, how do you explain someone who is fully vaccinated dying after contracting the virus? Now, this is very pertinent, Miriam. Like I said really at the beginning, we condole with all of you. And now there's what we call dying from COVID and dying with COVID. You could also die after COVID. And this is what is actually happening at a time like this. A good number of patients have succumbed to conditions such as heart disease or diabetes, or even blood clots in the heart, in the vessels, and in the lungs, all most likely associated with COVID or as a consequence of COVID. So when COVID attacks a person, it causes a storm, as we have had, and it decimates just about everything. And for a good number of people, especially those that have had stays extending to the ICU or high dependence units, they really live when they are generally much weaker. And the risks of clots, actually, a number of people have died from what we know medically as pulmonary embolism. So you may have had your doctor telling you getting COVID does not exclude you from what we call the traditional causes of death, and cancers are still taking the lives of many. Heart failure and diabetes, stroke, these are still very, very prevalent. In fact, when someone gets critically ill with COVID and they need ICU, much of the treatment that we give them is not directed towards the virus. The virus, by that time, a week or 2 or 3, is long gone, but you are fighting the side effects or the after effects of the virus. The fact that it has caused a storm to your vessels, to your lungs, to your brain, to just about anything, to the kidneys. And this is what is responsible for the death of so many. The National Drugs Authority, it is the one that approves and governs all medication used on humans and even animals here in the country. Now, the recommendation is that Covidex will be used as a supplement. So it supplements other treatment. It has not been labeled as a cure. As for whether it will be in the future, I think the study is ongoing, and I'll leave that to NDA. In the meantime, the active ingredient that is in Covidex is known to reduce the virus in the oropharyngeal tract, or that's why someone swallows it, or some is put in the nostrils. And the point is that it will reduce the virus that is residing there before it accesses your body. Now, when the virus accesses your body, the story actually changes. The story changes. So the biggest benefit as a clinician is for one to prevent getting the infection, and probably that's where the best benefit from COVID-19 comes. Now, if you cross to the ICU or the high dependency unit, the game has changed pretty much, because at that point, the virus, like we have said, is many times long gone, and we are fighting the effects, after effects of the virus. And COVID-19 there, all clinicians will attest to this, will not be of benefit. So this supplement is good for prevention, and please, when you get sick, get care from a qualified health worker, and we know what to administer for you there. But further details, the NDA is available, and the ministry, that is pretty much within their docket. Lillian is asking us to throw more light about muscle pains after getting the AstraZeneca vaccine, and muscle pains among those that have survived COVID. So muscle pains, this is a known side effect of the vaccine. In fact, some of the people feared that it would be so painful. We saw many people on TV really shrink after the jab was given. But if you look at them now, all the public figures that took the vaccine, none of them is crying. But when they had just taken it, it seemed to be a very painful shot. I personally took mine, and there was quite a bit of pain here, really. That lasted about a day. And with a painkiller and a cold compress, it went. But some have gone on to get muscle pains even beyond the site of injection, like the back or the limbs. Typically, these have subsided within 2-3 days, maximum a week. And like I said, the painkillers have been very helpful. It's a known side effect. Please, you may anticipate it, and a simple painkiller will actually help for bed rest and taking enough fluids. You will be good to go in no time. And we've also seen this among patients that actually get COVID, and for a good number of patients, they are presented to us with the only complaint being back pain, only to get them assessed, and you find they're breathless and their saturations are low, and you go on to do a COVID test or a CT scan, and it turns out positive. So beyond the jab, the vaccine can actually present with, rather the infection of COVID can present as back pain. It's very possible, and the healthcare workers, I urge you to look out for that as a presenting complaint for COVID. I'm glad you're enjoying this, and we are glad to see all your questions coming in. That means that you're following us on our YouTube page, on Facebook page, as well as Twitter. The Doc Talk Show is our handle. We go for this short break, and we see you shortly.
You are watching the Doc Talk Show.
The Ministry of Health informs the general public that during this COVID-19 pandemic, we should not forget to take our children for immunization. Parents and caregivers are reminded that the immunization services are still accessible at all government health facilities. Please take your child for immunization on time. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
Echa COVID-19 kijja kuggwa only if we stay at home, observe physical distancing, wear masks properly, sanitize or wash our hands with soap and water regularly, or get vaccinated now.
Bueno, yaba no mojo, yaba no. The garo retire nyina naza kumuni minga. Otio, ha, kante ni kinkureba. Ay 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 ay. Reba banda. Reba katutum. Ay ay ay. That's what. Yes, rip like a baby at home. Yeah. Thank you.
Katoto, hold on. What about immunization?
No. Nga, immunization bossy, tuza kuchikoro wanyi.
Katoto, your son is a citizen of Uganda now. Atogo no mwana witu. Our government has assured that all these essential vaccines, they are free.
You mean immunization is free?
Yes, so we have made sure that there are several health center units where you can take Katabazi and he gets essential vaccines. Before Katabazi reaches the age of 13, he will need to receive immunity.
Yes.
Against polio.
Polio? Ha! Whooping cough.
Tetanus, measles.
Yamawe, measles,
hepatitis, influenza. No. The government will even support you by giving you a free mosquito net to help fight against malaria.
Umwana kazarerwa.
Yes.
Amurere maura down the corner. Yeah, yatunga immunization.
You are watching the Doc Talk Show.
Welcome back from that break. We are glad that you are still with us, and we are glad that you are playing our part to give you reliable information regarding your health, which is very, very important. We are kicking off this segment with a question from Eliabu from Kawempe. Eliabu is asking if he has tested positive for COVID, and this was 2 weeks ago, should he go on to take the jab? Now, the guidelines are, if you have any symptoms of COVID, as you know them, fever, maybe difficulty in breathing, body pains here and there, a flu, a cough, or any sign that may be COVID, you do not want to take the vaccine, because the combined effect of the vaccine and the disease that may be COVID may overwhelm your body, and you may not do so well. So if you have active disease, COVID, and signs and symptoms, you should not take the jab until 2 weeks after your last symptom, or symptom, as we knew it in the beginning. So if you've had any symptoms of late, please wait until 2 weeks have elapsed before you take the jab. For the case of a positive test, if it has been positive with symptoms, the same applies. That is 2 weeks after your last symptom. If it's just a test, then you must demonstrate another test that is negative, and then you can undertake the jab. That's very important, because generally, if you have disease and then you get the vaccine, the side effects of the vaccine, or the process of generating a good immunity coupled with the infection, may overwhelm your body. So that's very important. And in fact, before you take the jab, you answer a few questions of whether you've been coughing, or have a flu, or have body pains, or the fever, for that matter. If you take positive on any of those, and it can't be explained otherwise, then you're excluded from the jab until 2 weeks after the last of those symptoms has passed. That's very important. Thanks for asking that question, Eliab from Kawempe. This is a very interesting question. Can the vaccine be oral? I don't know if the motivation for this question is a fear for jabs. Sorry about that, Enoch, but we do not have an oral vaccine yet. But it's barely 2 years since we experienced the first case. You never know along the way. Maybe it's possible. Science is not sleeping. Anything could happen. But as things are, it is an oral. It's not an oral jab. It's not an oral vaccine. You must take it. Yeah. Needless to say, there are a good number of oral vaccines for other infections. I must mention measles, which is almost gone throughout the world. It is vaccinated through a few oral drops given to the children. So we don't have an oral version of the vaccine yet. Who knows, it could come along the way. But brave up, guys. Let's go and offer our arms for that shot and be a hero to yourself, to your family, and to the country at large. I have information that the vaccine is very much around the corner. In no more than 2 weeks, we shall be lining up for this vaccine. Please get ready for it. We have another question from Kawempe, people of Kawempe. Thanks for watching. And this one is asking, do people on heavy medication, for example, ulcers, hepatitis, hypertension, HIV, heart disease, also get vaccinated? Yes, please. The presence of one infection or another condition altogether in your body, actually, all around the world, it is these people that have these what we call comorbidities that are actually the concern of most, because some of the medication used could lead to your immunity being lower. The conditions themselves are known to be associated with low immunity. Also, the restrictions that come along with, say, diabetic patient, or the patient that has hypertension, a patient that has kidney disease, someone that has heart failure, they actually limit your ability to get protected, say through diet, because you tell you don't eat this food, don't do this, you can't walk this much, you can't exercise so much. So these people are very, very much at risk. And in fact, they are part of the priority group that must be vaccinated before anyone else. So our people in chronic care, you're attending diabetes clinic, you're attending hypertension, you are on dialysis, you're attending Heart Institute, or your doctor is treating you for any long-term condition, please be the first to get the vaccine. And in fact, the health system is prioritizing these people. That is the talk of the nation. That's how do we get our older people vaccinated, how do we get those that are already sick fit, and the vaccine does not harm them in any way. It has very, very good protection. And results are coming out from many studies, including our own centers. Many of the people that are on dialysis have done fairly well. People that are attending the heart clinics, they are doing fairly well. On the contrary, it is those that may not have been suffering from many chronic conditions that have actually passed on. And this actually re-emphasizes the need for the vaccine. So please get vaccinated if you have any chronic condition. One last question that everyone is actually asking. Yes, doctor, the vaccines are coming, but where shall we go to get them? I am reliably informed that the doses we are getting are probably more than the ones that have been around, and I can predict that there will be more vaccination centers. I can't tell now, but my guess is that where you got the first shot, chances are high that you'll get the second one. I condemn those that actually brought what was proven to be a fake vaccine. That's very unnationalistic, and it harms the whole process of protecting the world against COVID. So, doctor, yes, the vaccines are coming, but where shall we go to get them? First of all, make sure you're safe when you're going to get vaccinated. We do not wish to see the queues we saw in some of the vaccination centers. They're really against the social distancing that we are talking about, and people thought that they would leave their mask back home since they were going to get the jab. That again is really not proper. So because the doses are going to be more, like what has been availed previously, chances are that you get more centers providing this vaccine. My guess also is that if you had got your first shot, the chances are that where you got that first shot from will be a vaccination center again. But I want to leave that to the Ministry of Health and the task force. They know best how they will safely administer this vaccine. I just need you to get ready for the vaccine when it comes. Please take the jab. It is one of the most proven ways of protecting ourselves against infection, but most importantly against severe disease and death from COVID. Please only get your vaccine from a center that is accredited by the Ministry of Health. I condemn, in the strongest terms possible, those that were involved in the distribution of vaccines that were actually proven not to be authentic. So the ministry is there to guide us, and the health centers that will be designated, or any other vaccination centers, is where we should go for the vaccine, and looking forward to having many of you going for the vaccine. We must thank everyone that is involved in the protection of individuals and communities or groups of people against COVID. We are really very, very proud of you. I personally give you many medals. I wish I had them physically. I would come out and hand each one a medal. You've done so well, social distancing. We know the pain of the lockdown, but we strongly believe that the efforts are underway to make sure that life goes back to normal. But it begins with you. Keep that mask on, keep that social distance, and please sanitize and avoid the many gatherings that are bound to happen when, in case they open us up soon. It is the Doc Talk Show that you have been watching, and from the crew here, wish you all the best. Stay safe, keep that social distance, and sanitize. Stay well.
Professional and compassionate doctors talking real solutions to real health problems. The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
Digital Tracking Solution. The Digital Tracking Solution, DTS, is used by both local manufacturers and importers of products specified by Commissioner in a gazetted notice. It is compulsory for these taxpayers to apply tax stamps.
Uganda Revenue Authority. Developing Uganda together.
Nature that nurtures our life on Earth determines the geographical surrounding that should be protected and preserved by the community. Our environment is a program that will showcase the importance of human responsibility in a healthy environment, that is to say, conservation, waste management and recycling, disease prevention, biogas, to mention but a few. On UBC, Inspiring Uganda.
This week on UBC.
Now, this session is actually a very special one because there are so many questions, needless to say, arising about COVID. How long does it take to take a second dose after the first dose of vaccine? Uganda has basically used the AstraZeneca vaccine, COVAX as we call it, and the recommendation is that within 4 to 12 weeks. And Uganda has been doing 8 weeks, and we can actually push it to about 12 weeks. It is really fine either of those. And the second question is really very related to the vaccine. Can I contract COVID-19 even after my 2 jabs? The answer, straightforward, is yes. I have lost my sexual urge since I was vaccinated. Is it a side effect of the vaccine? I am very glad that you're watching.
The Doc Talk Show.